what is sentinel lymph node biopsy? When we do surgery for the breast, whether it is a lumpectomy or mastectomy, we always actually test the axillary lymph nodes also. So earlier what we did was, for everybody, whether it's stage 1, 2, 3, all stages, we used to remove all of the lymph nodes. Now why do we remove lymph nodes? One, to know if there are cancer cells seen in the lymph nodes, so whether the cancer is spread to the lymph nodes or not, and if it is spread, then obviously we have to remove it to treat it. Two, if it is involved, if the axillary lymph nodes are affected by the cancer, then we check the number. So depending on whether it is affected by cancer and how many lymph nodes are affected, then this determines the stage and what treatment we give. So this is a very important information. It is also an important information for prognosis to determine the outcome of the treatment. So this used to be vital information. This still is vital information, and it was done for these reasons. Now when we did that, we also realized in a large proportion of people, particularly with early breast cancer, we were removing this unnecessarily because many of them do not have tumor cells spreading to the lymph glands, and if there is no tumor in the lymph glands, removing the lymph glands do not serve any purpose. So it also, when you remove all of the lymph glands, there can be complications such as arm swelling, what we call as lymphedema. So in order to avoid these complications, we started selecting patients for axillary clearance. So only certain patients with a possibility of possibility or a higher chance of having the lymph glands affected, in those patients we did a clearance. In other patients we do what is called as sentinel lymph node biopsy. Now what is this sentinel lymph node biopsy? So this when the lymphatics from the breast actually drain into the axillary lymph glands. So the first set of lymph glands which drain the lymphatics are often the sentinel nodes. These are like guarding nodes. So if these nodes, if cancer has to spread to the axillary lymph nodes, these are the nodes that are likely to get involved first. So if these nodes are taken out at the time of surgery and checked by a technique called frozen section, and then the pathologist says that there are no tumor cells in these glands, then it is safe to assume that the rest of the lymph glands do not have cancer cells. So we do not have to remove all of them. But if the pathologist says, while we do the surgery and wait for the result, if the pathologist says that there are tumor cells found in the lymph glands, then other cells, all the lymph glands also might be affected. So in which case we go and remove all of the lymph glands. So this procedure of selecting which patient requires axillary clearance is called sentinel lymph node biopsy. So to do this operation, we use a special blue color dye and sometimes use a radioactive isotope. These two agents, the radioactive isotope and the blue dye, helps us to locate where are the first draining lymph nodes present. So when we cut an open and see, you see this blue colored lymph nodes. We also use a special equipment called gamma camera to find out the node that signals the radioactivity. And then we select those nodes, remove it selectively and send it to the pathologist, and if they tell us that there is no cancer there, then we do not have to remove the rest of the lymph nodes. If they tell us that there is cancer, then all the other lymph nodes are removed. So to put it in layman's terms, it's like an example, if you have a gatekeeper or a sentinel or a guard or what we call as Gurkha at the gate. Now if a robber comes, he has to cross him to come inside and rob us or do any harm to us inside the house. So if the gatekeeper is safe, then we can assume that all of us inside the house are safe. If the gatekeeper is affected, if the robber comes and knocks him off, then there is a chance that he may come and do damage inside the house also. Same principle as far as sentinel lymph node biopsy is concerned. By selectively doing sentinel lymph node biopsy, we avoid complete axillary clearance in patients who do not require it, thereby preventing some complications called lymphedema.